So again, this is that concern of overtreatment. I have a node-positive patient, they don't benefit. How do you struggle with that? So Marla, what is your thought process in your conversation?
Well, I was just thinking back to when I first started using Breast Cancer Index many years ago, and I'd be on the phone all the time. I don't understand. This is high risk, and they're not going to benefit. So it was a learning curve for me as well. But I go back to the data. This is what we do, right? We don't make, random decisions. We go back to our data, and the data for Breast Cancer Index is very, very strong. If they're not going to benefit, they won't. If they will benefit, then we know that they are going to get about a 2/3 risk reduction. So if you're comfortable and understand the data, then it's fairly easy to say this is what we're going to do. And sometimes the more challenging is obviously a patient who says, well, I want to stay on it anyways, all right? So that could be a challenge. But usually, again, relying on the good data that Breast Cancer Index has makes it easier.
So Mayra, you as well, those node-positive patients, how comfortable are you in saying, okay, if you're a no, we are going to stop you even though you were node-positive?
Yes, again, this is when you, you explain to the patient the data, and you explain to the patients that we have ASCO and NCCN guidelines now. We also explain to them, this is what you are going to derive the most benefit from at this time, these changes in your life, whether it is, stopping smoking or, exercise, weight that, and also, the AIs and the tamoxifen have an impact on your weight. So, being off of it, we know that now that you don't have it, this is when you're going to have, the best benefit in your efforts.